Good morning. My name is Dr. Catherine Hodge. I'm one of the co-chairs of the COVID subcommittee at Nkhoma Mission Hospital. Around Christmas time, we found that we were in the middle of our second COVID surge. This surge was much more infectious and deadly than our first surge last summer and fall because we now have the South African variant of the coronavirus, which has been a lot more infectious and deadly in our population. So we came together as a subcommittee with members such as Mr. Kachiponde from the pharmacy to look at what we had in our current ability to help our patients and what we urgently needed in our first group of patients who were so sick.
Yeah, good morning. I am Fred Kachiponde, the pharmacist. As Dr. Catherine has highlighted, indeed, the first wave of COVID, we managed to get the oxygen concentrators, which we could manage to manage on our patients who were coming to the hospital. But this second wave has made us to think otherwise, to have more of the oxygen cylinders, which we have managed to buy using the donor money. And we have also managed to get some PPEs, which are in high demand all over. Above all, I think the cost of the PPEs has gone up due to demand. So we really appreciate for your help, and we would like to ask all the donors to continue supporting us until this wave goes off. We are trusting that the Lord will help us to go through this.
In our first COVID surge, we didn't have enough patients to need staffing frequently at the ward. But in our second surge, we found that we had multiple patients at one time who were very, very sick. So we needed clinicians and nurses and cleaners to be helping us in the ward in more of a full-time staffing. So we also requested that in our donor appeal, that we would be able to be given funds to essentially open a new ward. This is our COVID ward. As you can see today, we don't have any inpatients. In the last 3 weeks, we've had 9 inpatients. 8 of them we've been able to transfer urgently to the COVID treatment facility in Lilongwe. We've also had many outpatients who are able to go home and quarantine safely. And then for the first time this week, we had a positive COVID inpatient here who passed away so suddenly. So that is much more of an increase because in the summer and fall surge of COVID, the first surge, we only had 1 inpatient and all of our other cases were well outpatients. So we know this strain is much more infectious and deadly. Several of the patients that we have transferred on to the Bingu National Stadium treatment facility have passed on, and a number of them have survived. So we know that it's a much more serious situation this time around. In this ward, we are now able to provide oxygen cylinders. These are all full with 100% oxygen. Our concentrators were able to deliver 5 liters per minute of oxygen, which is just a little bit of a help, whereas these are able to give up to 25 liters per minute. And that can be the difference between life and death and serious organ damage for our patients who first get stabilized here and then get taken on during their transfer to the Bingu National Treatment Facility in Lilongwe. So that's really helpful. We also now have rapid test kits. So just like in the US, you also have these rapid test kits, and in other facilities around the world, we are moving a bit away from the PCR test, which takes 2 to 3 days. This is also giving us an answer in 15 to 20 minutes, and that really helps us make a quick decision what to do with our sickest patients. Just like the rest of the world, we're facing the same challenging situations. We could not be giving our patients the care that we can give them now without your partnership and without the help that you as donors have delivered. We're so thankful that you are in the trenches with us and that you see our brothers and sisters here as your brothers and sisters, and that you haven't forgotten us and that you've done so much for us to be able to give the response that we can. Thank you so much.